How many times you experience panic attack? As a dentist, I witness panic attack very often. And a lot of people close to me going through that unfortunate event. And I always want to create some type of a helpful handbook for people to understand what it is and what to do in case of such a stressful situation. And just for you to know, as a dentist, I want to assure you it's very stressful, not only for the patient, but also for the provider. So for other providers who are going through such an experience, like I do, I want to put all my remedies together. What you can educate on a course of action during the panic attack. First of all, I want you to understand you're not alone. It's a very common situation. 11% of Americans going through panic attack at least once a year. The most common scenario in the dental office, I notice what people experience panic attack after dental anesthesia. But it's not always, and a lot of people experience it with the blood work. A lot of people experience it during the exam tests, and it can be a lot of different scenarios. We're all living very fast life with a lot of stress and anxiety around a lot of events. So panic attack is just a representation. First of all, you have to acknowledge what this is the brief period of concentrated anxiety, and it will be over soon. A lot of people ask me what caused panic attack. It's not so clear. It's caused by both chemical imbalance and some genetic predisposition. But what's important is to recognize the symptoms of panic attack. If you feel shaky, little bit disoriented, feel the dry mouth, have a hard time breathing, sweating, and your heart beats very rapid and irregular, most likely that's the panic attack. It's important to know what panic attack usually lasts 10 minutes. It can be less, but after 10 minutes, the symptoms are gonna get easier and easier. So when I see my patients going through the tough moment, I have several steps of strategy. First of all, I want them to repeat loud with me and then have that mantra inside the head. It will pass soon, because it will pass soon. And I want them to repeat it and repeat it. That words, it's gonna help. Second, we start practicing breathing technique together. I want them to close their eyes and focus on the breath. I prefer what they do it through the nose. They inhale on 4 very slowly, and I count 1, 2, 3, 4. During that time, I want them to feel the air going through the nose, in the back of the throat, in the chest, and in the diaphragm. And then hold for 4. 1, 2, 3, 4. And then exhale. Again, focus on the air going from diaphragm, through the lungs, back of the throat, and out through the nose, or they can do it through the mouth. But they have to constantly focus on the breathing and repeat this technique several times. Now, technique number 3. I call it 5, 4, 3, 2, 1 rule. And that time they have to include all their senses. They have to identify 5 things they can see. window, door, floor, artwork, chair. Then 4 things they can feel. I want them to feel the skin, the hair, texture of the short, material of the pants. Then 3 things they can hear. They have to focus on the sounds around them. Then 2 things they can smell. And 1 thing they can taste. They can put something sweet in the mouth. Then technique number 4. I want them to start focus on the body and get up, do several steps, and do some body movement with the hands, with the legs. And then the 5th technique called tension relaxation technique. That time I want them to sit, tense the leg muscles, and hold them up to 4, and then relax. And repeat it again with the legs, tense and relax. They can use the other muscles like a core, make it very tense and relax. They can use the arms, hands, tense and relax. But I want to have a kind of strategic approach to that situation, and I want people around me, I always recommend to have a diary. It can be in the shape of paper diary, or it can be the phone. In the notes, to record the whole situation, what exactly happened. Maybe they can find what triggered it, and after they record it, to analyze the situation. That's very important. They can do it by themselves, or with a loved one, or with a medical professional. Also, I find very useful to use lavender inhaler and inhale in case if they feel the beginning of those symptoms, as we talk about, fast heartbeats, inability to breathe, shaking, dry mouth. And I find that lavender is a great coping mechanism, and it gives, kind of sense of relaxation. So if you or someone around you, your loved one, experience panic attack or complain or scared of previous experience of panic attack, please advise them to use those 5 effective techniques. As soon as they feel dizzy, disoriented, shaky, and so forth, start repeating that mantra. It will pass soon, because it will pass soon. Second, I want them to start breathing slowly, preferably through the nose, and count to 4 when they inhale with the eyes closed and feel the air going through the nose, throat, lungs, up to the diaphragm. Then hold to 4 and exhale, also feeling the air going through the diaphragm, chest, back of the throat, and out through the nose, and then hold again. Now use the 5, 4, 3, 2, 1 rule. 5 things to see, 4 things to feel, 3 things to hear, 2 things to smell, and 1 thing to taste. Also start moving your body, do the different movements. And the last technique would be tension relaxation technique. Sit, make your leg tense, the leg muscles tense, hold, and relax. And repeat with the other group of muscles. If you feel what you like this information, please sign up to our YouTube or Facebook channel, Sleep Apnea Breathing Snoring Help. This way you can find some other important messages we're trying to share with the world. If you are a medical or dental professional, please use our channel as a networking ground to communicate and collaborate with other medical and dental professionals, because only together we can put puzzles of sleep apnea and sleep and breathing disorders and find the best solution for our patients. And if you are someone who suffer from trouble sleeping, or sleep next to the snoring partner. Please use this helpful information. Click like and share button. This way you can help us to spread it, the word. And because we believe that everyone deserves a restful sleep and good breathing. Thank you very much. And we're looking forward